All right, so let's do our 10-minute review here on heart disease. Heart disease is one of the biggest killers of our population, has a profound effect on our health. And if we can start understanding the causation of why this disease occurs, then we can take steps to addressing it and healing it. So I'm going to give you some background information here and then some steps to consider taking in order to begin moving forward with this if this is something that you or your loved ones deal with. So let's take a look at some anatomy first. So the blood vessel. So the blood vessel is the good representation of where heart disease is acting. Now it can happens in the heart tissue as well, but the blood vessels are really the biggest places that this irritation, inflammation, plaquing, eventual occlusion or obstruction of blood flow that can lead to heart attack and stroke. That's where it occurs, is in the blood vessel. So with heart disease, there's always this initial insult to the vessel. So in your vessel, blood vessel, you have these different layers. This interior layer is called the intima. You have what's called the media, which is where more of the smooth muscle is found, and then the externa, which is kind of on the outer surface of the vessel. So in that intima, when heart disease starts to take place and kind of gain traction, there's an irritation that begins to occur. And that irritation, you may have heard of the term oxidation. So things start to oxidize. Oxidation is like rust. It starts to wear down and break down a little bit. And so through that oxidation, through that irritation, eventually we start moving towards more of an inflammation. So inflammation is when the body starts mobilizing more of its inflammatory mediators, its immune system, in order to deal with that inflammatory threat. And when that inflammation starts occurring and really starts gaining traction, eventually we get these cells called foam cells that start to take place, and that's what eventually creates this plaquing. So plaquing, right, is the buildup, the cholesterol. So, when we run lab tests to check for cholesterol, that's a cardiovascular screening in order to assess if you're having higher cholesterol levels, then maybe you're laying down more of this plaquing, which that is not an accurate statement. I treat so many individuals that have high cholesterol and they have absolutely no plaquing going on because we run what are called carotid artery ultrasounds, or we'll look at calcium score tests. So if you have high cholesterol, make sure you're working with your doctor to evaluate things appropriately. But for this circumstance, yes, cholesterol will begin coming in, and it's mostly the LDL cholesterol. That's the low density lipoprotein. That's the kind of car that cholesterol rides on, that carries it into this vessel. It gets laid down over those foam cells and starts creating this plaquing. If that plaquing keeps building up and building up and building up, remember, blood flow is coming through this vessel. And if you build up enough and occlude or block that blood flow, that's heart attack or stroke. So that's the general physiology. We call it pathophysiology, kind of how the initial adversity begins, how it will eventually develop, and then the outcomes, as I mentioned, can be catastrophic from heart disease. So remember, conventional mindset is just going after cholesterol. We go after that cholesterol. If we can shut down your body's production of cholesterol, then we're going to win the game. But remember, cholesterol is not the foe here. Cholesterol is part of the system. Cholesterol is just building up because it's responding to the inflammation, which is responding to that initial irritation and oxidation. And it's actually cardioprotective. Now, if the environment allows it to continue to build up, then that is obviously not a good outcome for the individual, but the body's just responding. It's doing what it's supposed to be doing based on its inflammatory state. So when we start to think about how we address this, we've got to go after that inflammation. So a couple ways to do that. Supplementation. People love supplementation because it's simple, it's effective. It's a very important part of the formula. So we can start going after that oxidation with one of the best antioxidants, CoQ10. 200 to 300 milligrams of CoQ10 works great to lower this irritation, inflammation, oxidative effect happening. Essential fatty acids, about 4,500 milligrams of EPA, DHA combined, are very effective at helping to thin out the blood, lower that inflammatory state, lower the omega-6 fatty acids that we get through all our seed oils, and arachidonic acid, that's pro-inflammatory. So essential fats are excellent. Vitamin C, 2,500 milligrams to start with, and more can be very effective. It help is another kind of antioxidant influencer. You can really ramp up the vitamin C. You can really go to bowel tolerance. So that means taking enough vitamin C until you have some loose stool, then back off. That lets you know your body's requirement of vitamin C. Once the plaquing takes place, there is targeted supplementation like nattokinase, lumbrokinase. These are actually kind of clot busters on one hand. The effects of these allows the system to start breaking down that clot formation. And just know, targeted supplementation, excellent. I love that. But what I love more is going after true causation. So true causation is when you start looking at the contributors into the environment. Remember, supplementation doesn't change the environment. Supplementation aids at giving resources to the body to influence and have an effect on this adversity that's occurring. But treating causation is really where it's at, in combination with supplementation. But so what irritates that intima the most nutritionally? Sugar. Sugar irritates that tissue like nothing else. So much of our, the diabetes that we deal with, the pre-diabetes we deal with, the metabolic imbalances. I mean, like 95% of our population is metabolically imbalanced. That means they have dysregulated blood sugar happening, higher levels of blood sugar. It's below the threshold of diabetes or even pre-diabetes, but it's happening in the system. That irritates this intima, those high sugar levels. What else happens? Stress. Through the promotion of cortisol and epinephrine, increased stress begins to inflame that inner lining. And that is huge. It's significant. Remember, hypertension is another aspect. High blood pressure. Through stress, the blood pressure goes up. That pressure also irritates and breaks down that inner lining. So our need to have to work on our stress response states through meditation, through breathing, through exercise, through working on our belief systems is extremely important when it comes to addressing heart disease. Last one I'll touch on is toxicity. I mean, toxicity is like, I feel like we know it, but we just don't know how to understand it. But we have so much toxicity residing in our environment. It has a direct influence on these tissue structures, on the tissue structures within the blood vessels, on the tissue structures within our organ systems, in our heart, in our brain. And we build up, we accumulate toxicity in these tissues. And what happens is that toxicity infiltrates and we gain an inflammatory response to it. I mean, the body's looking to try to deal with it, and it deals with it through inflammation. And when you're looking to begin understanding, like, how do I reduce my toxicity? I mean, that comes in the form of, our toxicity comes in the form of pesticides and, herbicides, antibiotics create toxicity within the system, mycotoxins from fungus, and just, again, living in our world has toxicity elements to it. So we have to take approaches to addressing that toxicity through looking at how we detoxify the body. I use a system called homotoxicology, German biologic medicine, or biotherapeutic drainage, these methods to really detoxify our cellular environment. So when you look at heart disease and you look at these different contributors to how we get to this place, methods that we can start taking to improve that existing environment, and then going after causation, I mean, that is a formula on how you recover your health and you move towards wellness and away from illness.